Chronic high blood sugar, if left untreated, can lead to serious health problems and life-threatening conditions. To understand the key terminologies used in this video, pause now and check out our video on insulin and digestion. Diabetes is a metabolic disease that concerns chronic elevated blood sugar. It's categorized as type 1 and type 2. It's important to know their differences as their causes and treatment differ. In type 1 diabetes, an autoimmune condition where your body's immune system becomes a rebel. It mistakenly attacks your beta cells of the pancreas, remember the islets of Langerhans, shutting down insulin production and resulting in high sugar levels. Patients with this condition are dependent on insulin. It means that the patient needs to take insulin daily in order to live. The reason for this is believed to be genetics. Now, moving on to the more common type is our type 2, which is a completely different story. This is where either our body doesn't use insulin well or the body is insulin resistant. The cells are not responsive to this insulin, which leads to insufficient glucose delivered into our cells. Unused glucose accumulates in the bloodstream and results in increased blood sugar levels. This means that the patient needs to take insulin and other diabetes medications to supplement the difference. An unhealthy lifestyle and diet play the most important role, usually in this condition. Type 1 and type 2 share some common symptoms. You can remember by thinking diabetes affects your sweet life. Our sight becomes blurry. We can expect weight loss, fatigue or that energy drop, excessive thirst, toilet trips increase, lengthy healing time of wounds, infections like in those diabetic ulcers or thrush, feeling tired constantly, again that fatigue, and elevated blood glucose or sugar. For type 1, it's simple but non-negotiable. Insulin is your new best friend for life, meaning insulin therapy is lifelong. Monitoring in insulin therapy will and always will be a must. Type 2 can sometimes be managed through lifestyle changes together with medications. For the complete guide on insulin therapy, pause now and watch this video. Type 1 diabetics can be very thin and fragile and have a hard time gaining weight, while type 2 diabetics are usually overweight and overeat. Type 1 is not reversible, where type 2 through lifestyle changes is reversible. Type 1 diabetics are only insulin dependent, where type 2 diabetics can also take medicine like metformin and glipizide in order to control it without insulin. So as the attending nurse, if we're dealing with type 1, we should be looking for ketones and also monitoring blood glucose in both patients, paying attention to the medications, the lab work such as their A1C, and if they're type 2 diabetics, ensure lifestyle changes and smoking cessation, along with staying away from high sugar foods, weight management, and always watching for signs and symptoms of hypoglycemia. Blood sugar can also become highly elevated in both, but the symptoms are very different, which I will make a video on that exclusively explaining it. But remember, DKA is common in type 1 diabetics, and HHS is common in type 2 diabetics. Thanks for watching.
If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.